Go ahead.
Welcome to Western Medicine, the Humanity Behind the Vanity. You're on Talk 1260 KTRC. I'm Dr. Daniel Ronel, a board-certified plastic surgeon. We're talking with my wife, Betsy Ronel, on a show that's generously sponsored by the makers of Artefill.
As my cheeks are sponsored by the makers of Artefill, thank you. I love them.
All right. What do you want to talk about today?
Let's talk about the trends you've seen this summer, starting from the beginning of the summer.
All right. In the beginning of the summer, we were seeing a lot of requests for breast augmentation and tummy tucks because people were realizing they'd get their surgery and they'd be ready in time for school. Now that the summer is almost over, I'm getting a lot of requests for laser and filler combination on the face. It's a facial rejuvenation that takes a couple stages, takes a few months, and so people are actually thinking about the holidays now, getting ready for the holidays. So, you know, what they do is they come in for the beginning of a series of treatments with our laser, which will get rid of sun damage on the surface of the skin and sort of help prepare the skin for the filler, which then comes in, it's injected deeply and it elevates the soft tissues and eliminates some wrinkles. And the combination of the laser and filler, I happen to be liking Artefill very much for this, is
it doesn't
really
even hurt when it goes
it's a
in.
very, very nice
Excellent.
combination.
So, but you can't do a laser after you've had filler within a certain time period. Are they getting their laser sessions first?
You can with Artefill.
Oh, really?
Yes, you
Oh.
can. I'm
Wow,
on
you
this.
cannot with the others.
Right, with Radius it'll melt, but I've just been named to a scientific advisory board for Artefill.
He's one of 8 doctors in the whole nation that's been named to the scientific advisory board for Artefill.
Yes, and we're
That's
actually
a big deal.
we're going to have a meeting next
Huge.
week. But one of the things we reviewed,
Major.
one of the things we reviewed was that lasers below a certain temperature, it's actually about 600 degrees, does not melt the Artefill, but it does melt the Radius. So. I happen to think it's a good idea to do laser first and then Artefill second, although
How long do
depending...
you have, I mean, what is the length of time? Say I signed up, I'm a patient, I want my laser, I want to fix up my skin and my
Right.
face, I don't want a facelift. So I want my laser package.
Uh-huh.
How many weeks does that take?
It depends on how damaged your skin is now. It can typically take 2 months. It may
How
only
many times do you
take,
have to go during those 2 months?
you know, every 3 to 4 weeks, sometimes
That's
every 6
twice.
weeks. It
In 2
depends. It depends on your skin type, and it depends on what kind of laser therapy you're getting. And Marion Urban, who runs the Sterling Institute in my office,
Right.
she's the laser expert, and she does the skin analysis, and she decides how often and how many and what kind of laser, because we have different ones.
Right.
And so typically it takes about 2 months to get the skin ready, and then I go ahead and put in the filler. Now, for logistical reasons, some people need to do it the other way around, and with Artefill, it's easy to do that. With
That's
Radius,
really
it's
something,
difficult.
because I couldn't have certain laser treatments over the past couple of years because I was using the other fillers, Radius and Juvederm.
Right.
They're excellent too.
Right, they all have different qualities
Right.
and different price points, and they last different amounts.
Right, Artefill is the most expensive
Right,
because
right.
it's supposed to last the
That's it,
longest.
right.
It's supposed to last 5 years.
It's actually the most bang for the buck, although it is expensive initially.
Right, but it lasts, you know, it's like one of those things, you're paying more at the beginning, but in the end, you're probably paying the same, if not less, because you don't have to go back for as many treatments.
Right, and what's nice is when you do go back for a touch-up or something, the stuff is still there.
Right.
It's still in you, whereas with the other ones, the stuff is starting to go away.
Right, so you need more.
Right.
It's
so-
interesting, balances out in the end. But I'll
Yeah.
tell you, he just did my cheeks about 3 weeks ago with Artefill, and you know, I've spoken before about how unbelievably painful these fillers in my face were. Some women are like, yeah, whatever, with like a mosquito bite. It hurt me. And so I was all anxious and prepared. I really was fine. I mean, of course, a needle going into your face hurts for a second, but what hurt me the most was the pressure of the filler going into my face. And with Artefill, because it's so smooth and silky, there was no pressure. So wasn't it a totally different experience with me?
Mm-hmm. That's what
Yeah.
we talked about before. How
I didn't divorce him 5 times. I didn't curse the day he was
Right,
born. You know,
right.
whatever the nonsense is I say. But
It was-
yeah,
yeah,
it was
fine.
a
And that's
great
what
experience. And such minimal bruising.
Right.
Right? I had like one little punch mark on my face, and that was it.
And you got lucky. You know, some people do bruise.
Right.
I just did my office manager's lips today,
Oh, good.
and
Yeah.
I'm surprised she swelled up a lot. Actually.
Oh, really?
Yeah.
That's
for about,
normally not like her.
No,
Yeah.
but and she didn't feel anything either.
But she's tough, that woman.
But she swelled for about an hour and a half, and then by the end of the day, she was fine.
I swelled too. Remember, I swelled up right away. But then by the next morning, you would not have known I had anything done.
The point is, what people are doing with this combination, it's a package that we're doing of Laser and Artefill.
You mean a price package, or you're just saying this is what's coming in?
Both.
Okay.
It's a price package, and also it's replacing a facelift, and it's replacing surgery for now. And it helps, in many people, it helps put off a facelift for a couple of years.
That's true. One day I came in there, and there was an older woman, certainly over 60, with good skin, but she had some wrinkles on her face, and she was curious about these liquid lifts. And she saw me, obviously, you know, I'm half her age, but she really liked, I told her what I was like before, and what she obviously saw what I'm like now, and she signed up for it. She never wanted a facelift, but she obviously wanted a little change, and this was her solution.
Mm-hmm. Yeah,
so that was nice.
Yeah, I like it. I think it's an excellent solution.
That's great. I like it.
Right, right. And now, you know, we're recording right now. This is August. By the time the package is done, it'll be around Thanksgiving, and the people will be ready in time for the holidays. They'll look really good, and that's why they're thinking ahead for this.
Yeah, and these are things moms can do because it's not going to incapacitate you like a tummy tuck. You know, when you're lying on your bed, we can all take our kids to school soon. We can, you know, do our normal stuff. We just might be a little bit bruised and swollen over the next couple of months.
Exactly.
But big deal.
So in summary, I mean, I'm using Artefill with a laser package, but you know, there's other fillers out there, and that work just as, you know, well doing other things.
Yeah, Radius and Juvederm.
Right.
Those are your other picks.
Yeah, Radius does a liquid lift also. It just doesn't last as long.
I mean, I had beautiful results with Radius.
Yeah,
as
just
long as it lasted.
right, and it cannot be used in the lips, and that's where Juvederm comes in, because Juvederm is also silky smooth.
Yeah.
It can be used anywhere: the lips, the nasolabial folds, the eyebrows. I put them sometimes in the eyelids themselves to fill in
When
dents.
you're getting sunken,
Mm-hmm.
yeah, with age.
But it doesn't last very long. But they're all useful,
Yeah.
and they all have their own